My name's Teresa. I'm one of the nurse practitioners here. How are
Nice to
you?
meet you.
Right.
Doing well, thank you.
I'm here to see you because you came up on a specialist.
A specialist of what?
You're on a specialist of patients who are back here. To tell you the truth, Medicare is now looking at this very closely.
There's a new program here at Robert Wood Johnson University Hospital in New Brunswick, New Jersey, and many other hospitals around the nation. It targets patients like 84-year-old Freda Kerner, who the hospital calls a frequent flyer. That's because she keeps coming back. She was first hospitalized in January with abdominal pain. 10 months later, in November, she was readmitted with pneumonia. Did you know that you were getting weaker and having more trouble
yes,
breathing at home?
Yes.
Do you want to come to the hospital again?
No. As nice as they are, I really would rather stay home.
The hospital is certainly interested in providing better care for patients, but that's not the only reason to keep someone like Freda Kerner from being readmitted. Robert Wood Johnson University Hospital is also trying to avoid Medicare penalties for what the government calls excess readmissions. It's a new policy that went into effect this past October as part of the Affordable Care Act, meant to save the government more than $250 million just over the next year. Since 2010, the federal government has been keeping track of readmission rates at more than 4,700 hospitals and posting that information online. They're looking to find if patients are readmitted within 30 days for 3 specific conditions: heart attack, heart failure, and pneumonia. And because Freda Kerner has pneumonia, she's on the hospital's watch list.
Deep breath for me.
Dr. Josh Burshad is the chief medical officer at Robert Wood Johnson University Hospital. Was the readmission rate here too high?
I think it was. And in one category for pneumonia patients, it was shown to be too high. It was worse than expected.
In the past 4 years, his hospital's readmission rates have been higher than the national average. As a result, the hospital says they'll face penalties of more than $1 million over the next year. That's because they're being penalized 0.8% out of the maximum 1% penalty of their Medicare reimbursements.
I take this as a personal insult. I really do. I take a lot of pride in us doing a good job for patients.